Abdul Malik, physician associate and health educator. I hope you all can hear me. Please let me know if you cannot, if there's any issues with the sound quality. I haven't done this in some time, so I usually go live on Instagram. So I think this may be my first time going live on YouTube. But if you can hear me and you happen to be on, I'll wait for some viewers to come on before I get heavily into my topic. So if you saw my thumbnail from this morning, I plan to talk about sexual harassment in the workplace, and in particular, as it pertains to in the healthcare setting. And I wanted to base some of my talk on this book. I hope it's not backwards, but this is Prevent Workplace Harassment, Proven Policies That Keep Your Company Out of Court. So for those of you all who don't know me, my name is Omar Abdul Malik. I've been in the healthcare field for 30 years. 20 of those years have been as a physician associate and health educator. And I currently work as a hospitalist, PA, in Washington, D.C., where I live with my wife and children. So obviously, workplace sexual harassment has become a very hot topic. Usually, I would say, given the advent of the Me Too movement, so that's the movement that really addressed the issue of sexual harassment in the workplace, in particular as it pertains to women, for the most part. I think that was initiated about maybe 4 or 5 years ago. Now, you would think men would learn. All of the CEOs that have been lost their positions, and even certain religious leaders who have fallen from grace. You'd think they'd have learned, but I think a lot of it has to do with we men, with the way we are nurtured in a society that's very heavily misogynistic in many ways, and the way we are expected to act as boys, as teenage boys in particular. So boys will be boys, quote unquote. Just kind of making remarks and ogling girls, and starts as young as middle school and elementary school in some cases, and that's become an issue. But when that behavior isn't corrected, voila, you have a full-grown man in the workplace who thinks it's okay to do or say certain things to women, in most cases. So in most cases, it's men initiating sexual harassment upon women. Obviously, ex-mayor Cuomo has been stepped down from office as the head of New York, and he said a lot of things in his resignation speech about him not understanding the culture, the new culture in which he was working. He said that he suggested that it was a generational issue, that he didn't understand this younger generation and boundaries. Well, he and I are not, I'm in my 50s, he's in his early 60s, so we're not that far apart in age. So, that can't be used as an excuse for not understanding this new generation. You millennials and you Gen Zers, I don't know what to make of you guys. Why can't I touch you? Why can't I say certain things to you? Also, as far as a certain being of the Italian culture. Now, I have Italian family members in the Italian culture and in the black culture in many respects, and Hispanic culture. Touching, physical affection is quite common. But I think we all, to some degree, understand boundaries. When things are getting they've crossed the line from just a person expressing their affection to kind of creepiness and line stepping. You got to kind of use your instinct, or be open to being educated. When a person says, listen, I don't like the way you're touching me. I don't like when you make certain remarks about my body. I don't like the way you're looking at me. you have to stop that immediately. So in this book, Preventing Workplace Sexual Harassment, I want to give credit to the authors. This was written by, this is an old book. It's one of my thrift store haunts. Oh, hello, Michael Collins. How you doing? So this book was written by a group of female attorneys. This is what I'm reading from. I'll give their names because I want to give them due credit. So Pamela Fagan, Lori R. Jones, Susan Sorrells, Jennifer George, and Amy Nicole Jacobs. So these are all attorneys that got together and wrote this book, and they go over a lot of the guidelines that should be addressed in the workplace as far as trying to prevent workplace harassment. Sexual harassment specifically was kind of included in the Civil Rights Act of 1964. But what I learned from reading this book is that it specifically was not addressed. Sexual harassment as an actual complaint, a formal complaint, a formal charge, was not addressed until the late 80s, and that was with some landmark cases. One was Meritor Savings Bank versus Benson. It was 1986, and the court upheld the notion of a sexually hostile environment. And this was saying that, according to the court, a victim need not suffer a tangible detriment to her job, such as demotion or discharge, to be successful on the claim of hostile work environment or sexual harassment. Instead, the court reasoned that employees have the right to work in an environment free from discriminatory intimidation, ridicule, or insult. So this kind of led to things like the Equal Employment Opportunity Commission, that kind of codified definitions of what constituted harassment. It's a request for sexual favors. It's a kind of a quid pro quo kind of thing. Like, yeah, if you do this sexual favor for me, there is an advancement or a pay raise in it for you. And I think there's a company, Alibaba. It's in China, I believe, that's now come under scrutiny because there was complaints by many women that went unaddressed, that they were saying they were being sexually harassed for years, and that was part of that culture. So we see even in the United States of America, sexual harassment is not unique. The women who worked for this company, Alibaba, were saying that they felt coerced to go to drinking parties with male superiors and perform or drink alcohol and get drunk. Had sexual favors requested of them, and if they didn't comply, then they were either fired or demoted. And if you can imagine, all of us, most of us watching this video, can relate to being in the workplace environment. What do you do when you're not a superior? When you're in a position to be fired or demoted or denied a pay raise, and your boss is overstepping boundaries, and you feel compelled to comply with whatever sexual favors those are, or if they're not asking you not asking sexual favors of you, but just making sexual remarks. Now, I've experienced this. I've seen it. I'll give you a few examples. One was I was a professor many years ago, and a couple of colleagues of mine were brought up on charges of sexual harassment. Now, it was kind of surprising to me, but what I found is that they would ask me for letters of reference and say, hey, Assalamu alaikum, Qasim. I would say I would say things like, okay, you want me to write a letter of recommendation for you saying that you would never do such and such a thing to a female student. You're a person of good character. I can do that, but I can't say that you would never sexually harass a female student. I'd like to think that I wouldn't, you know. But I can't sit up and say, oh, I would never do such a thing. I would never do such a thing. I don't know what I would do if caught up in the moment or in a moment of weakness. So you have to protect yourself from yourself. We men in particular, the flesh, male men tend to be very weak in this instance. I did have a very good mentor. I won't say his name, but he does who he is, Dr. B. He advised against men. If you're one of the faculty members, don't be in your office with a female student, in particular, a young female student. Don't be in your office with the door closed and especially locked for long periods of time. Now, I would have female students, they kind of would confide in me. I think I was a young college professor. It's in my early 30s. And they would confide in me as like a big brother. They'd come in, some of them would close the door. Mr. Malik, I just have to get something off my chest. No pun intended, but I just want to talk to you about this situation. So here I am with this young female student with the door closed and you lose track of time when you're in a heated discussion, whether it's listening to somebody or talking to somebody. So what I think may be 5 minutes turns into 15 or 50 minutes in some cases. And then that student comes out, and then people are looking at me like, why is that female student in Dr. Malik's office all that time? And I had a student say that to me, a male student say that to me one day. He says, oh, wow, she was still in there? And it kind of woke me up. I was like, okay, I need to be careful how I carry myself. I can't let female students come into my office, close the door, and just chat, or if it's something where it's school related, they need help studying or something, or they're having problems with a particular issue in the class, address that, but then invite them out of your office. Okay, we've been in here, and keep a time. I started getting to the point where I had an office in the hospital where I used to work, and I would keep a clock and say, okay, you've been in my office for 10 minutes. You've said what you had to say. Now it's time to leave. It's time to excuse yourself from my office. It's just not a good situation for you to be in. I've seen what was clearly sexual harassment on the part of doctors. And one was an older doctor who would give unsolicited back rubs to a secretary who was working in her office. And the secretary would kind of giggle and squirm uncomfortably, and you got to be careful about this. Again, speaking to men, a woman may laugh as you're touching her or saying something to her. She may smile nervously, and you say, oh, well, she kind of enjoys it, or she doesn't mind. But maybe she does mind. Maybe that nervous giggle or that nervous smile, is her trying to cope with it. We saw this with some Harvey Weinstein cases, because his attorneys were saying, well, the women that he allegedly did this to were smiling and laughing, and there's a video of the woman kind of play flirting with him. And he said, well, see, there you go. It was mutual. It was a much younger woman. I would say this as a man who's in his 50s. I feel it's my responsibility to set an example for younger women in particular of how a man should treat you. So in this particular instance, the older doctor would give this younger woman these unsolicited back massages and things. And I asked her later. There was another older worker who was in the female worker who was in the office also. We had a big office, and she would just be like scowling at him. I said, oh, you didn't like when he did that, did you? No, I don't like when he does that. So I asked the younger female, I said, do you mind when he gives you back massages and things like that? She said, no, I really don't like it. So I said, well, do you want me to say something? She said, no, he's the doctor. Don't say anything to him. Yeah, I don't want to cause problems. And I've heard this from so many women who have confided in me. They've said, well, I don't want to cause problems. I said, okay, if you're coming to me about what you feel to be sexual harassment on the part of this professor or this doctor or this senior staff member, and then you're telling me that, and I'm offering, like, I'll give you my support. I'll write a letter, I'll talk to the person. Then you say, well, no, I don't want to cause problems. I've heard this from so many women over the years of just being in the workplace. So women, don't be ashamed or don't be afraid to speak up for yourselves. And men, if you feel sexually harassed by another man or a woman, yeah, you have the right to speak up also. Let's see, let me take some questions here. As a male nurse, I missed it. Okay, so I missed that comment there. Yeah, so you know, I'm talking about the workplace setting. You're going to see this a lot, in particular in the healthcare setting, because in healthcare settings we work in very close proximity. You know, we don't socially distance during a code. You know, there's no way to possibly do it. And I've brushed up against women because, like, somebody's doing chest compressions and somebody else has got to intubate. Then I'm running the code and somebody else is putting in an IO. Somebody else is checking for pulses. Somebody else is using the ultrasound to try to get a pulse. Yeah, so codes are very chaotic. So if you watch any of these TV dramas or movies, we're bumping into each other. We're brushing up against each other. We're leaning on each other. So you got to really be careful. I had one of my mentors, who was a very good doctor who used to run a emergency room, told me about the time he was doing chest compressions, and this woman who was attracted to him brushed her breast against his back as he's doing chest compressions, and as he was doing this, were those nipples? And he turned around, and the woman was giving him this kind of come hither look. He was like, what the heck? He was like, oh, it really creeped him out. So that's when women sexually harass men. So as a male nurse, would you recommend any strategies when treating patients and drawing boundaries? I know in clinical settings, sometimes we must get hands-on. Yes. So I've had patients confide in me that they fell in love with me. So I said, well, that's very nice. You know, but, you know, this is a professional setting. I let everybody know I'm married. I've been married for 26 years by God's grace. But you have to set, like, I don't joke, I don't even play flirt at the workplace at all. I flirt with my wife. That's it. I had a nurse ask me, well, you know, there's nothing wrong with a little playful flirting, right? And I said, well, to me, it is, because where is your boundary? And I ask my wife about this all the time. I said, well, if I said to a woman, wow, you really look good. I love that dress that you're wearing. It's beautiful. How would you take that? She said, well, it really depends on, you know, where you are at the moment. Some people could take that as, wow, what is this guy hitting on me? Or they could be like, oh, thank you very much. So as a male nurse in particular, you really have to set boundaries. I had a male patient many years ago. I used to help run an HIV clinic, and this was a gay patient of mine. He was very aggressive. He crossed boundaries. He said, you're fine, look at self. Where you want to do something after clinic is over? And it really, he'd get extra close to me, and then you know, I'd have to examine him, and he'd be like, oh, that feels so good. And you know, he'd just make little comments, and I said, listen, bro, you're being disrespectful. I've been respectful to you. I call you Mr., let's say Mr. Doe. I call you Mr. Doe. I say, how are you doing, sir? You know, why are you disrespecting me? And I had the nurse come in, and you know, as I was doing physical exams on him, he says, well, why is she here? I said, because you're acting up. You're being unprofessional. You're not, you know, I would like to reciprocate the same amount of respect that I showed to you. Excuse me. And he later told me, he later told me that he just wanted to mess with me because he felt I was so perfect, and he was a very intelligent guy. He made some very bad decisions in life, and he was bitter about that, especially getting HIV. And he felt that I was Mr. Perfect. I was who he was supposed to be. So I said, listen, your life isn't over. You don't have to resent me for what you feel to be my success. But we have to be respectful to each other, just like I'm being respectful to you. So that's, you have to be very clear about your lines. When you're touching patients, I used to teach a course called History Taking and Physical Diagnosis. So if you're allied health, you'll know this book, Bates. So in the course, you got to do things like you're taught how to do breast exams. A group of nurses came in and actually disrobed, and we were doing, my classmates and I were doing pelvic exams on them as they're instructing us, like, okay, stick the speculum in there. Okay, no, that's too far. And you're like, oh, this is so weird. But that was good for me because my first rotation was OBGYN, and I wound up doing a bunch of pelvic exams with speculums, and there's digital rectal exams and things like that. So in doing that, number one, if you are a male clinician, make sure that there is, and you're doing something like a breast exam or a vaginal exam. I've got patients with vaginal bleeding. They've got to get checked out down there, or you're putting in a catheter. As a male nurse, my very, very, very strong advice would be to have a third party in there with you, either particular female, so a female nurse, medical assistant, or a CNA, because you can get yourself into a lot of trouble if unnecessarily. And I've seen it happen to colleagues, and it's really unfortunate. They're dismissed from work. They're on paid leave until there's an investigation that's done, and a couple of them confided in me and said, I literally didn't do anything, but this woman accused me of sexually molesting her. I didn't do anything. But it's a very hard, no pun intended again, it's a very difficult accusation to overcome. And we saw in the case, you don't want to be that guy who has that type of accusation brought against him, because your chances of beating that is very difficult if there wasn't anybody else in the room with you and your patient. So you have to set very strong boundaries. You've got to safeguard yourself. I'm friendly with my patients, but I'm not their friends. I make that very cleer from the beginning. Some of them invited me to lunch. Oh wow, I just love the care that you give me, and you're so nice, and God, I'm just crazy about you. I want to take you to lunch. That leads to a slippery slope. And unfortunately, there's been clinicians who have had sex with their patients. They've fallen in love with them. And you can't do that. You cannot do that. You've got to set very serious boundaries. Patients have written me poetry. I've got a poem from a patient. She mounted it and you helped save my life, which I did. But you just have to safeguard yourself, because as a clinician, you got to understand that you're in a position of authority over that patient. When I go to the doctor's office, that doctor is in a position of authority over me. If he wants to do a digital rectal exam, I'm scheduled. I'm in my 50s. I'm scheduled for my first colonoscopy, which I'm not looking forward to. But that's a very invasive procedure. So when patients come to you, they are concerned enough about their health to disrobe in front of you, divulge things to you that they have not divulged to their family members, how they feel, maybe certain conditions that they have. A lot of my HIV patients, families didn't even know they had HIV. So I'd have family members calling me, like, yeah, hey, doc, how come this person's coming to see you? Do they have something? I can't tell you that. And they're fishing, trying to figure out what their family member may have. And they're also, your patients are concerned enough about their health to let you stick instruments into their various orifices, if it's the mouth or their nether regions. Whether it's a Foley catheter, a Flexosil, a speculum for examination. So that's a huge trust that can never be breached. And unfortunately, every single year, some clinician is found to be sexually harassing patients. There was a colleague of mine, a PA, who was at a very well-known hospital that's now moved to D.C., but he had gone on record of sexually abusing several male patients, and this was a pattern with him. And it was very unfortunate. I didn't know the guy personally, but the fact when they said PA, I was like, oh God, there's not but so many PAs in the country, and you had to go do this. Now people aren't going to trust PAs. Of course, we know the case of Dr. Larry Nasser, the ex-doctor now, who was molesting a lot of the female gymnasts. He tried to cover it up and say, well, this was part of the procedure, and here's a video of me doing this procedure to these female patients. But he later admitted to it. You've got to safeguard yourself, guys. I cannot stress that enough. With your female colleagues, who are your peers. So if you're a PA like me, my peers are the nurse practitioners and the PAs. I'm very careful around them. I don't play flirt. I don't touch anybody. I don't say things to them. Dang, girl, you looking good with your fine, thick stuff or whatever. And that segues to like a certain culture. In the black culture, some aspects of the black culture, unfortunately, we can do this kind of black thing where we're joking. Oh, girl, I'm just messing with you. Oh, girl, I don't mean nothing by it. I'm just talking. Don't do that. This is the exact same excuse that Cuomo was using, saying, well, it's a cultural thing. I'm a very affectionate man. I like to joke a lot. Don't do that. It's better to err on the side of conservatism. Sometimes I get scoffed at quite a bit. Like, oh, it's just so perfect and so proper. Listen, I want to maintain my marriage. I've worked very hard for my degrees and my certifications and licenses. I don't want to ever be brought up in charges of any type of sexual harassment. And you have to set the standard at the workplace. You could do what you want, at the club. Well, no, you can't do what you want. But there's certain settings where I guess flirtation is more acceptable. But you have to be careful. Listen, as a female starting a direct entry BSM program and hoping to be a PA, thank you very much for being respectful. You're welcome. You're welcome. So, women in particular, no man should be ever ogling you. And this is part of, again, giving reference to this book, there's a list of things that are considered unacceptable, and that's by the Equal Employment Opportunity Center. So no man should be ogling you, like looking you up and down. No man should be saying anything to you that's inappropriate. And be careful with joking, because I've seen people who are friends at work. I've seen guys say stuff to women, and the woman kind of gives like, hey, oh, watch out there. I'm an ICU nurse. This is very good information for any student. That's right. Yeah, thank you. And I've seen men say things about women's bodies. Maybe the woman's working out, she's losing weight. Hey, girl, you looking good. And the woman will be like, okay, thank you. Different things that are like disgusting. Girl, you so fine, I could drink your bathwater. That's gross to me. But to the guy, that's being real cool. And the woman will kind of look like, okay. That may come back to haunt you later. Because let's see, there's a good bit of static in the background. Oh, I'm sorry. All right, so I'm trying to figure out where that static is coming from. There is a thunderstorm going on outside, so I don't know if that's pertaining to it. I hope you can hear me, though. Sorry about that. It's a technical difficulty. But you have to be careful. Let me see if I do this. I got this in my... I hope that'll be better. Um, you men in particular, and I would say this, forgive me for talking about race-specific things. As a black man, I'm extra careful just because of history. I know as a black man, if I get accused of doing something, in particular by a white female, I could get in a lot of trouble. I would feel like I was done. I was like, okay, I'm done. I might as well pack my bags up and go work at McDonald's if they'll hire me or something. Uh, you just have to be extra, extra careful. Watch what you look at, how you look at a person. Watch what you say, the intonation in your voice. You know, that's a nice outfit you've got on, versus, "Dad, girl, you looking good." You know, definitely don't touch the person. Do not put your hands on anybody. Be careful of joking. Like I said, I've seen people say offhand comments about a person's body. Well, that person I've got a coworker who's lost a lot of weight, used to be obese, and really worked hard to lose weight. And people have been making comments. "Dad, girl, you too skinny. Dad, girl, you ain't got nothing back there. You know, I yeah, I miss looking at you." This is entirely inappropriate. And she confided in me the things that people were saying. And sure enough, people were just saying, men, just saying any old thing. "Dad, girl, you don't leave me anything to look at anymore." What the hell? You can't say this. This is blatant sexual harassment. And again, if you feel sexually harassed, you have to have the bravery to speak up. You can, if you don't feel comfortable saying something to that person in front of other people, like, "Listen, that's an unacceptable thing for you to say to me," or, "I don't like you touching me like that. You don't know me like that. You can't give me a back massage. I didn't ask you to touch me like that." You gotta, if you don't feel comfortable doing that, see the person in private. If it's a superior, this takes a little bit more guts, because then you're thinking about, okay, am I going to get fired? Am I going to get demoted? Is this person going to come after me? Our next employment review, am I going to have bad things said about me? You know, am I going to be in fear for my job? You can confide in somebody else. Go to your human resource department. My suggestion for everybody, and I tell young students this who are coming into the field, have an attorney. There's certain law firms that will allow people to pay a monthly fee where you have an attorney um, on on record. I forgot the term that I want to use. I'm having a mental block, but you'll have you can retain you can kind of retain an attorney. I think there's a group called Prepaid Legal, where they if you pay them a monthly fee, you'll be able to have your own attorney. And you can say, "Well, listen, I feel uncomfortable with the way the things you've said to me, or the way you look at me, or the way you touch me. I've asked you not to do it. So now I'm taking legal matters." Now, my mom was a nurse years ago. She's retired now, but she went through this for harassment by a superior. And that superior backed off once she had an attorney. Woo! You get a phone call. If I'm being accused of sexual harassment and I don't stop you can't tell me how to act. I'm gonna do to you what I want to do. I get a letter or a call from an attorney. I'm like, yeah, that it, that stops everything in most cases if the person is sane minded. But you have the right to protect yourself. And do understand that sexual harassment can go both ways. Again, quoting from this book, paraphrasing, um, there's been cases, sexual harassment laws don't just protect um, women from being harassed by men. It protects women from being sexually harassed by other women, and men being sexually harassed by women, and men being sexually harassed by other men. So that's the world in which we live. And as my children transition into adulthood, they've been working. The older ones have been working a couple of jobs for a few years now. I just let them know. I educate them. I say, "Look, guys, you're in the workforce now. You know, don't do anything that can be perceived as sexual harassment. Don't let anybody say or do anything to you that can be perceived as sexual harassment." There's no more statute of limitations. The things that Cuomo's done, the things that our own president and even the erstwhile president have done on video. You're like, well, why would you do that? Why would you put a woman's getting an award speech. Biden did this. I'm going to talk about it. A woman is about to receive some award, and you put your nose into the crook of her neck and sniff deeply, and then whisper something into her ear, and she's clearly like, what are you doing? You can't do that. Men get harassed by men more than you think. Yeah, that's exactly right. That's exactly right. Uh, Again, we have to support men. We as a society have got to support men who get sexually harassed at the workplace by other men. Remember Terry Crews, the comedian and actor, was sexually harassed by some Hollywood mogul, and unfortunately, brothers did not give him the support that I think he needed. They were like, "Oh man, if I'd have done that, I'd have punched the dude in his jaw, man. I'd have done this to the dude. He'd have been done." You don't know until it happens to you. It happened to me. I was working as a personal trainer at a gym many years ago, and this guy started touching me in a way that I did not want to be touched. It's like, so well, what is that about? And I didn't know what to do about it because he was a patron. So I kind of jerked away, and I told my superior. This guy didn't work at the gym; he was a gym patron. But it made me very uncomfortable, and I was like, "Oh God, that was really weird and gross." But I felt creeped out, and I felt like, well, was that really sexual harassment? And but it was. So your guts will let you kind of know that. So that's all I really have to say for that. My goal is to kind of do a live video, Lord willing, inshallah, once a week on a controversial topic. So next week, I think I'm going to be talking about COVID, which are all maybe ethical issues surrounding COVID. I'm really concerned about ethical issues and things that we would consider controversial, especially as it pertains to the healthcare setting. So I hope you all found this beneficial. Please consider subscribing if you haven't subscribed already. Uh, you're welcome. This is AM92. Inshallah, I will continue your good work. Yeah, Michael Collins. If you have to ask yourself about sexual harassment, most likely it is. That's true. So I hope you all found this beneficial, Lord willing, inshallah. So I wish you all the best of success in your positive endeavors. Take care. Peace.